Welcome to Hawthorn University's webinar series, everybody. I'm Paula Bartholomew, and it's my pleasure to facilitate here. Today we have Dr. Deanna Minich returning to discuss toxins and detoxification and the application of nutrition and lifestyle. And we'll certainly save time at the end of Dr. Minich's presentation for your questions and comments. So I just want you to add them to the webinar panel anytime during the presentation, and then I'll pose them for you. And I encourage you to keep your eyes on the chat box too throughout the presentation for additional supportive information. Hello, Dr. Minich. I'm really glad to have your colorful self with us here again at Hawthorn.
Oh, it's so great to be here with you, Paula. Thanks for the request to come back.
You bet. And it's a great topic for us at Hawthorn. It's really, I think it's your topic. So I'm thrilled to have your expertise here. And as we were talking, just getting ready to go live, Dr. Minich was talking about the volume of information that she wants to share with us today. And so I want to let us go for a 75-minute presentation here, followed by question and answers. And I'm sorry to anybody for not giving you a heads up ahead of time, but I think you'll be thrilled with the presentation that you're about to get. And I think this topic is so timely because it's just vital for us as nutrition and health professionals to be able to understand the context of detoxification practices as they relate to health and disease, and really to understand the general view and the acceptance in the medical arena as well. Dr. Minich will identify the biochemical and the genetic pathways involved in detoxification processes, and will also frame the role of nutrition, nutrient actives, botanicals, and lifestyle factors in modulating these detoxification processes. So let me tell you just a little bit about why we asked Dr. Minich to come back to present this. Dr. Minich is a health educator and author with more than 20 years of experience in nutrition, body, mind, health, and functional medicine. She holds a master's and doctorate degrees in nutrition and has lectured extensively throughout the world on health topics, teaching patients and health professionals about health. She's a fellow of the American College of Nutrition, a certified nutrition specialist, and a certified functional medicine practitioner. Her passion is bringing forth a colorful, whole self approach to nourishment called Whole Detox and bridging the gaps between science, soul, and art in medicine. All right, Dr. Minich, I'm certain that you're ready to begin, so I want to turn this over to you now, but I do want you to talk about your upcoming Rainbow Food and Supplement course, your new Rainbow Diet book, along with the next Colorful Whole Detox that starts on September 22nd. So I want to save some time after your presentation to share that information too, if that's okay.
That sounds great. Thank you, Paula.
You bet. Okay.
All right. You're letting me go?
I am.
I feel like a bull that's just gonna get to that gate. I mean, as you mentioned, there's just so much that every slide that I'm going to show you in this presentation is like a portal into volumes of information here. So I did what I could in order to give you the high level 91 slides worth of what I think you most need to know. So since you're not receiving these slides, you'd have to watch the webinar again. So what you might want to do is get a journal and take some notes, because there probably will be some things. And I always like to make things super practical for people. And in this presentation, what I'm going to be doing is giving you a variety of different tips, things that you can do on a daily basis. I just recently got very passionate on my Facebook page about doing small things in your life in order to have great impact. So I think that detox is one of those things where we can make those small, teeny tiny changes and have some pretty phenomenal impact. On your journal or your piece of paper, whatever you have next to you, write down your questions as we go. And even if we can't field them within this sphere, we'll find a way to get your questions answered. So before I kind of dive into the meat of this, I do want to say something about kind of the mystical aspects of detox, and probably what drew me into this just more on a personal note. If I look back at all the things that I've been interested in, it's always been medicine and it's always been spirituality. So these two things, you know, and I do see that they are braided together. They do come together. Yes, they're parallel tracks, but then there are certain touch points that they do kind of intersect. And in one of those places of intersection, I see detoxification practices. Now, we use this term detox in the nutritional medicine field and in functional medicine, integrative medicine. But if we were talking about this from a spiritual tradition, we might call this cleansing or fasting or purging. Because if you look at medicine and its spiritual traditions, they go back thousands of years, and this was part of their practice, is renewing the body. And that's what we're talking about here. So as we dive into the first part, I am going to talk about toxins, and this is more or less the scary part for everybody, but I would say to let go of the fear, because fear in and of itself is a toxin, right? So what we want to do is focus on what we can do about it, but you first have to know what we're up against. So again, I'm pulling pieces that I've presented from various settings with healthcare practitioners. So some of my language is going to be along those same lines. We're going to talk about labs and other things. So the toxic burden, I'm going to just very lightly gloss over some of the sources of toxins where you could find them in your environment. Talk about the connection with chronic disease, why we need to care. And I think it's the responsibility of every single healthcare practitioner to do something about toxicity with patients, whether it's a psychospiritual toxin or a physiological toxin. We have enough information now to suggest that we have to do something about these things because they lead to chronic diseases. What are some assessments that you can use in clinical practice? And then what is a general clinical framework that you can use with patients or clients in order to stage or sequence a detox? This is something that we talk a lot about at the Institute for Functional Medicine, where I teach as part of the advanced practice module for detox. We talk about sequencing a detox to make it safe. And that is really important because there are so many detoxes out there. There are a dime a dozen, and some of them are incredibly stringent and unsafe for people. So I'll talk about that. So yes, everybody has a toxin load. Absolutely. There's nobody that's exempt, and we're born toxic, right? So you probably know of the Environmental Working Group site, ewg.org. They report on a study looking at 10 different infants, showing that even through the umbilical cord blood, that these infants were contaminated with upwards of 200 different toxins, and that's just at birth. And then, as you can imagine, as we go through life, that continues to increase. So I remember another study that showed something on the order of 700 different contaminants in the human body. And quite honestly, between you and me, I don't think that we even know of all of the different toxins. You know, we're only able to assess so many in a clinical report. So we don't even have a complete sense of all the things that are out there and how things get metabolized in the body. But the way that I like to talk with clients is to say that when we start to experience symptoms, it's almost like we have a toxic overload where those toxins build up. If our body is like a vessel, if it's like this cup that you see in the slide, and then all of a sudden we keep getting toxins, 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 and they don't go away unless we're doing something about them. And then eventually the toxins overrun, they spill over, and that spilling over moment is what I consider the moment where we have got symptoms. Now we've got allergies, we've got immune distress, we've got inflammation, we've got chronic fatigue, and we never had it before. We have infertility, we never had that problem before. So I guess, you know, if you have a hammer, everything starts to look like a nail. If you were living in this field of toxicity and environmental medicine, everybody and everything just starts to look like there's some toxic connection. So it's been estimated that there are something on the order of 80,000 different chemicals in the environment. More are made every year. And there are many that are just, as I mentioned before, we just don't even know about them. And in many cases, what we do with those toxins in the body, how we transform them, can sometimes potentiate or even make them worse. So I do a lot of travel, and what I've noticed, and I'm always looking for, what is the most pure, pristine place there is on the planet? And I have to say that it's not easy to find where you can really live and foster your surroundings where you don't have some level of toxicity. So I live in the Pacific Northwest, and so I live in a rural area, and you would think that well, gee, that sounds pretty good. That sounds pretty healthy. But no, my glyphosate levels are high. Ever since I started living here, my thallium, uranium, and cesium levels have gone up, most likely because of Fukushima and some of the contamination, irradiation in the water supply and in the fish. So it becomes really hard to find that perfect place anymore. So it doesn't matter if we live in a city, doesn't matter if we live in the country, we are constantly bombarded. The only place I'll say that I have noticed that it's pretty darn pure is Iceland. I had the opportunity to go to Iceland in at the end of December in 2016, and goodness, they have fish for breakfast, lunch, and dinner, and they have low toxicity. And if you look at where they're at, they're not very industrialized, not a lot of factories and chemicals and pollutants. So that's one of the rare places. But otherwise, no matter where we are, doesn't matter where we are in the globe, we're going to have something that we're up against. So this is how I look at the different types of toxins. Saying toxin is so generic. We need to really whittle that down into the many different types. So the first one is chemical. And typically when we think of chemical toxins, these are heavy metals. In fact, if I just said the word toxin to you and asked you for the first thing, you might say mercury or lead. These are common toxins that people think of. Mycotoxins and mold is becoming another big one. We could probably do a whole webinar just on mycotoxins and talking about mold, where you live and how it impacts you. So each of these can be a webinar in and of itself. Biological toxins, which would be viruses and fungi, and I would say even microorganisms there. Physical toxins, so things like radiation or trauma. Anytime that you're injured, your body is going through that inflammatory type of cascade, which is its attempt to really heal, but there can be a lot of cytokines, inflammatory mediators that are released, and so that can cause a lot of damage. Metabolic. In fact, I just finished writing this blog called The Power of One Meal, and it's amazing if you look at the literature out there on acute meals and what can happen after eating that meal. Let's just say that it's high in fat, high in sugar, not very nutrient dense. For 4 to 6 hours after eating that meal, we can perpetuate this, not an external toxin, but an upregulation of endotoxins. This is called metabolic endotoxemia. And I wish that more people were tuned into this, because as we get on this rampage of high fat this, high fat that, that's become like the latest trend, right? It used to be high protein, and all of a sudden we're moving towards fat. And it's not to say that good, clean, quality fat isn't an imperative within their way of eating. But what I see happening, and I've seen this trending during my 20 years of being in nutrition, is we get so enamored with something and we take it to the next level in a not so beneficial way. So now it's high fat everything, and there's no real discrimination and looking at that type of fat. The reason why I'm more concerned about fat too is because toxins tend to be lipophilic. They love fat. So just by the very fact of having fat in the diet incurs some degree of potential toxicity. So this whole thing with metabolic endotoxemia, I want you as nutritionists, if you are one, to keep your eye on that. I do think that keeping balanced with macronutrients and not getting too far over into one side or the other, unless it needs to be a therapeutic diet, is probably the best way to go. Number 5, psychological toxins. And this is one that I haven't always been keyed into as a toxin. Of course, you're always aware of the downsides of stress, but I've never formally labeled it a toxin until I would say the past 5 years. I've been thinking of it more and more as a toxin, because when we're stressed, we're almost completely different people. We react faster. Our autonomic nervous system is imbalanced, and that makes us react in terms of inflammation and our immune system, etc. So you're going to see that as I go through how I approach detox, I bring this element in pretty strongly. And then finally, I have a lot of interest in this last area, and it's all around allergy. It's not even just allergy, it's intolerance, sensitivity, and one of the things that we see that can be incurred in an allergy is toxins of various types. So, and foods can become toxins because we become allergic to them. So it's really important to be looking at all forms of allergy and hypersensitivity. So this is a slide that we talk about within the Institute for Functional Medicine, looking at the toxic equation. So why isn't it, okay, if we can't live anywhere that's completely pure, why aren't we just all sick right now and having some kind of chronic issue and debilitated because of our toxic burden? Well, because there are a lot of factors that go into this. First and foremost, we have to look at potency of the toxin. So for example, heavy metals, way worse than bisphenol A. So yeah, let's focus on BPA and all the other bisphenols and plastics, but you know what? They're not as damaging in many ways as something like mercury is. Mercury sticks around in the body for a long time. It lodges in brain, kidney, liver, bone. You know, these are really essential organs. The plastics, you know, they turn over more rapidly in the body. So your body is moving those through faster, whereas the heavy metals, they stay lodged and they have a longer term effect. So that's the first thing to think of is potency, weighing all of those different toxins and knowing what to go after. Duration, what was your duration of exposure? If you've had amalgams all your life, that's a pretty long duration of mercury exposure, right? Versus, you know, maybe just a short-term burst of driving past a field that's just been sprayed with pesticides. So duration plays into it. Dose is another big one. So the dose makes the poison. So if you start to have, and this is what's called the cocktail effect, when you've got a number of different toxins that you've been exposed to, they can have a cumulative effect. And if we go back to looking at that glass of water that's overflowing, that's kind of what happens is in and of themselves, probably these toxins are not all that detrimental. But when you have more than one of those toxins in this whole conglomerate, it functions as a united whole, and that creates a lot of issue. Now, on the flip side, we can also say that about nutrients, that we can create an army of nutrients to combat that army, that unified whole of toxins as well. But dose does play in. The other thing is genetics, for sure. And as nutritionists, if you are one, it is important. I know that genes are not our destiny, but you know what? They're pretty darn important when it comes to looking at the pharmacokinetics of these different toxins. We do, I believe, need to have some basic knowledge about working with a client if that information is available. And nowadays it's readily available. You can get your hands on a lot of these different SNPs in order to see what somebody is predisposed for. It doesn't mean that they have something, but a student just asked me this today. Do your SNPs ever change? No, your SNPs never change. Those are your base pairs. So you do 23andMe once and you're done. You've got your data. Now you run it through other systems to see what you've got going on. But how you work with your genes is your epigenetic pattern. So just because you may have some inefficiencies in your genes does not mean that you're predestined to be inefficient entirely at getting toxins out. It means that you probably have to work a little bit harder because you, again, depending on what you've got stacked against you or stacked for you, you just have to take that into consideration in this equation. So I think what gets bred around functional medicine and integrative medicine is, oh, it's not that important to get genes. I remember I was lecturing to 300 different healthcare practitioners of all types a couple years ago. And I asked them, I said, how many of you look at genes, look at SNPs? 3 people raised their hand, which I just found staggering because I really do feel like even though it's not the be all end all, it gets figured into the equation at some point. We are not going to talk about SNPs to any great degree in the presentation, but there are other webinars I'm sure that Hawthorn has done and other types of trainings on this. Maybe Paula will have me back to talk about nutrigenomics.
Absolutely.
Environmental factors is another one, just like I was talking about environment, right? You know, where are we located? Are we traveling? Are we in an airplane? Are we jogging on the freeway, you know, next to all the pollution? Are we indoors all the time instead of outside, where air pollution is 2 times that of what's outside? And then I added in another one, which is overall constitution and health status. And I do think that if we have health conditions of various types, symptoms, signs, we are a little bit more vulnerable. And so we've got to take care of ourselves here. We're even more vulnerable potentially to certain toxins than if we didn't have anything going on, because already our systems are compromised. So I want you to be thinking of this if you work with clients, how you can thread together all of these different things and be thinking about them, okay? And a big scale, the way that I define a toxin in whole detox is that it's simply a barrier. It's anything that's getting in, it's anything that makes you stuck, stagnant, blocks you, keeps you bound up, and doesn't allow you to flow, move, eliminate, excrete, sweat, cry, whatever it is. This is really what I'm after, is the metaphorical meaning of flow in a person's life. So as you probably know, we can probably do a sampling of everybody listing their favorite toxin here and what they're finding in their environment. And of course, if we go back to that algorithm that I showed you, really important to note what is most damaging. So air pollution, definitely lots of studies on that as it relates to cardiovascular disease. Get an air filter. Have your clients get an air filter. I use the Austin Air filter, which I think is great. IQ Air is another one. There are a bunch of them. Put the air filter in a part of the house that you're in for most of your day or night, and that tends to be the sleeping room. Actually, the air filter makes for a nice background noise. It's very soothing, it's very quiet, and plus the air is being filtered. Really important. Water. Usually when people ask me, I'll say air, water, and food. Focus on those things. Air is a big deal, but we don't have much control over it unless we have a certain setting or environment. Water, look at our bodies. What are we made of? 60 to 80% of our body is water. So we do need to tend to water. I would say that that's number one, that first and foremost. I mean, foods are made of water. We wash in water. It's just pervasive, right? We're drinking water. And so one of the things you can do, I'm going to say this all really quickly, is to get your water at home tested. The lab that most of us in environmental medicine like the most, Paula, I'm assuming it's okay to mention labs and names like this?
Yes, please.
Okay. The one we like the most is National Testing Laboratories. And I have no stock or anything with this company. I mean, it's just one that we talk about in functional medicine. Other people like it. National Testing Laboratories. It sounds very generic, but if you write it down, you can go online. I did this myself. I even just had water analyzed from my house after it was filtered, because I already know that probably the water I have in my house is not the best, right? So what happens after I filter it? Am I getting everything out? And then what does it look like pre-filter? So once you know what you've got going on for you with these contaminants, you can then go to the ewg.org site, figure out which water filter you need to fit those contaminants. Now, since I first had my water tested, I moved to a different house, which has a whole house filtration system. That I really feel is the way to go if you can do that. That's not something we built in. It was something that was already in the house, fortunately. But many people do think about shower heads. There are shower head filters that you can get, but make sure that water is filtered. That is like my number one. Plastic, you already know about plastic. We did a nice 7-day plastic-free challenge. Yeah, it's a problem, especially when we combine heat, oil, and plastic. Not a good mix. When I see these fish oils in plastic bottles, it's like, what are they thinking, right? I mean, not so good to have any oils in any plastic bottles at all. There's just too much interaction there. And if you think of how these things are shipped, we don't always get to see that, but they go through, hot trucks, and you get this, the plastic expands and contracts. That's a problem. Smoking, that's an obvious one, right? Alcohol and poor food choices, stress, EMFs, medications, polypharmacy, personal care products. I can remember a client that I had years ago. She had autoimmune disease. She had Sjogren's, and she had some other things going on. She was also celiac. She was losing her hair. And so I had asked her, I mean, she was a star. She wanted to get well. And so she changed her eating completely. We had that all on track, but she continued to lose her hair and just lots of different issues. As it turned out, she had a number of toxicants in her beauty products. So things that she washed her hair with, or mousse, or gels, or creams. She wore makeup, and we read the labels. She brought everything in a garbage bag because there was so much. It wasn't even like she could just put it in a little baggie or something. I mean, it was a lot of stuff. And if you think about it, we are using a lot of chemicals on our bodies. Most people are, and this has been researched. Essentially, the number that's been tossed out is, on average, women in the morning before breakfast are using something like 12 products with 126 different chemicals, and we're putting it on face, body, and hair. And for men aren't that far behind. They're at 8 products before breakfast. So something to think about there. Dental amalgams, and all kind. If you're interested in dental information, there is a website, IAOMT.org. If you go to that site, you can find functional biological dentists. I go to one myself. I mean, I don't want to mess around with my teeth. That's like one of the things I dread, going to the dentist, and I want it done right. And it just, you think pain, you think toxicity. So go to a dentist that goes the extra mile to know about toxicity. There are blood tests you can do before they do certain procedures. You might even be allergic to mint flavoring. There are so many different things that can be done there. And these people are becoming more and more accessible and visible in the dentist community. So it shouldn't be too hard to find them. Of course, the obvious: pesticides, insecticides, herbicides, and food packaging. So minimizing that as much as possible. Internal toxins, so emotional baggage, negative thoughts, inflammation. Before I got on this webinar, I was working on another presentation looking at all the recent science on pessimism, upregulating hypercoagulability in blood. So it's almost like, isn't that interesting? If you think of these metaphors and phrases that get distilled into our culture, like his blood was boiling. And usually when we hear that, we think, oh yeah, he was angry. Well, there's actually a study that shows that pessimism and having this tone of along that anger spectrum was connected to the blood being more clumpy, right? So that's not a good thing, obviously, because then you get all kinds of clots and other obstructions in the blood vessels. So psychology translates into physiology. I don't have to tell you that. Being the professional you are in this space, I mean, it's common sense. I think most people get it, that our personality, how we're wired, is going to translate into our physiology. So we just have to find what works for us. So chronic diseases, again, as I said before, once you start diving into the literature on all of these different toxicants, it would seem like everything, I'm teaching a course right now at a university. It's an online course on detox, and the first 3 weeks we go through it, everybody just gets really concerned about their own environment. But then they realize that, okay, now I'm aware. There were certain things I wasn't aware of, and now I know what I know, and I'm empowered to make these changes. Because if you look at the connections of these different diseases with toxins, and this is an abbreviated list, by the way, I'm not even showing you all the ones that we show within IFM. I just took some sampling of the more popular ones. Cardiovascular, obviously, I even mentioned the air pollution, but lead being connected to increases in blood pressure. Diabetes, another big one. Arsenic, I think of arsenic when I think of diabetes, but there are so many different studies on pesticides, insecticides, the POPs, persistent organic pollutants, and diabetes. Cardiometabolic disorders, why can't people lose weight? My husband, who's an acupuncturist, he'll talk with me at night about, all these people are coming in trying to lose weight. And I said, well, Mark, did you tell them to get a food allergy panel? Like, you can't stay in an inflamed state. Similarly, what is their toxic burden? There's so many hairdressers out there. I went to a hairdresser she was in her 40s, complaining of all of these autoimmune-like symptoms. And I'm like, I've got to tell you something. There is a connection with toxins. And you know, I mean, obviously when you're talking people's livelihoods, it's difficult to have that conversation, but there are certain professions that are going to be predisposed to having greater burden. And then we wonder, well, why can't I lose weight? Why do I have these chronic conditions? Well, there can be these occupational issues that we have these exposures to. So losing weight, you know, I do think of food allergy, I think of inflammation, I think of hormonal distress, and I do think of toxicity just because of the number of studies that I've seen. And these are studies where there's basically no emotional eating involved. These are animal studies where they give the animals the same diet, and in one of the animals they give them a toxin. They don't change the food or anything, and the animal eats the same amount of food and gets to be obese just from the injection of the toxin. They're not even changing their eating. So to me, that tells me that, you know, with so many people that are overweight and obese, there could be this connection to toxicity. And that's why doing a detox program before an avid weight loss program makes really good sense, because when we start to lose a lot of our adipose tissue, a lot of our fat, we're going to start circulating a lot of those toxins in the body. So it would be a really good idea to do a detox before we start losing lots of weight. Autoimmune, I've already been mentioning that one. I've had a number, for one whole year in the clinic, I saw patients with autoimmune diseases of various types. And this is something that I saw that all of them had in common, that there was some level of toxic exposure, even if that is stress. You know, stress would oftentimes bring on an event. So that's a big one. Cancer is the obvious one. In fact, if I didn't have any on here and I just asked you what disease seems to be connected to toxicity, you would probably say cancer. And for 5 years, I taught at a cancer retreat center, and so many of people were very upset about getting cancer because they felt like they lived in a very health conscious way. They're like, but Deanna, I ate organic food, I exercised, I did sweat, I, you know, X, Y, and Z, I did all of these things. I did all the things I was supposed to. Well, but we can't avoid certain of these contaminants in our environments. And that's not on them. You know, I think that that's where kind of the emotional part of this comes in of, you know, how did I do this to myself? And I do feel like with toxicity, sometimes we're not aware, and it's not something we're doing to ourselves. We don't even realize the impact. Neurological diseases, in fact, the three main systems that go out of whack when we're exposed to toxin overload are reproductive, neurological, and immune. And immune is very connected to GI, gastrointestinal. So when I see people starting to get headaches, tremors, I look at my dad. My dad has really bad tremors. And these are just essential tremors. Nothing is causing, I mean, there's no known cause, right? But I know he's got a lot of issues with a variety of different toxins. I just, you know, the nervous system is very fine in terms of its wiring and its sensitivity there. Reproductive, infertility, absolutely, absolutely. I could go on and on about each of these, right? Behavioral things, depression, anxiety. So you name it. I would challenge somebody to think of a disease that is not having a toxic connection. So think about that as we're going through the presentation, because I even say that congenital things from birth that we may have had without even incurring anything could have been done epigenetically. So we could have had the toxic influence for 3 generations before we were even born, right? So yeah, we'll get to the solutions. So what's really interesting for me, again, being in this field for 2 decades now, is how there are new terms cropping up. You know, when I was back in school in the early 90s, I never heard of chronic fatigue syndrome. We were never talking about that in our physiology courses or anything. Or, you know, multiple chemical sensitivity, what's that? You know, these are 21st century syndromes and sensitivities. Just even now, I mean, it feels like everybody has a food allergy or food sensitivity. Premenstrual syndrome, irritable bowel syndrome, a lot of GI, reproductive issues, fibromyalgia, we're in pain. So these are conditions that automatically I go right to toxicity, because again, it's just the age of where a lot of these things are cropping up. And of course, our healthcare, or should I say our disease care system, doesn't really know how to accommodate, right? Because we see these things are relatively newer conditions, and so we're treating we're giving a pill for an ill, trying to quell a symptom, but potentially creating even further toxicity. And so the people that I think of that you might have as clients that I think would really warrant doing a detoxification program would be, number one, couples wanting to conceive. So to mitigate a lot of the toxic burden that can be transferred from the mother to the child, especially if you look at the studies on nursing, breastfeeding, and how, you know, that's a very fatty substance, and how there is a transfer of many toxins. So getting the couple, not just the woman, the couple clean before conception. I think that that's so essential. People that have jobs and hobbies that are toxic, people with a compromised immune system, of course. You know, one of the biggest things is, you know, here we are as nutritionists, and we need to look at nutrient levels. One of the biggest protectors of us from having the exposure of these toxins is nutrients. Of course, and I'm going to get into that a little bit more, by the way. People who are losing weight, yes, you know, you want them to actually do the detox before they start to lose weight. I never consider a detox as a program to lose weight. Sometimes it just happens because people get healthy and their body shifts. So that can happen, but I don't see it in that same light. People that undergo bariatric surgery. In fact, there was one study that showed that within 1 year of having bariatric surgery, there was an increased amount of toxins in the blood that went up close to 400%. So, you know, we start to lose fat tissue. Where is that stuff that was in the fat tissue going to go? It's got to get out of the body some way. And so we have to prime those different processes. And as we get older, what tends to happen is we do just naturally become more fatty and less lean. So if fat, and you can have a skinny fat person, right? I mean, it's not about the ultimate size of the person. It's about their compartment allocation. And you know that doing a bioimpedance analysis can give you information on fat mass and lean body mass. And that will tell you how people stack up. So even though somebody may look thin, they can actually be on the inside, have a relative higher percentage of fat, which means that they could be even more toxic because their fat stores proportionally are higher. Another thing, if you look at some of the labs like from Genova, they will take, they'll look at things like triglycerides in the blood and standardize some of these toxins because, again, they hang out in fats. So if triglycerides are high, these are the plasma fats, that to me warrants, you know, some concern about the circulation of different toxins in the body. So looking at fat overall, and not to malign fat at all. I mean, my whole PhD was on fat. And so what people don't realize is that there's greater delineation and granularity within that topic of fats in our bodies and fats that we eat. And oftentimes the way that it gets translated in the media is just high fat, low fat. So we kind of dumb it down to this without looking at the complexity. And there's just so much there. So as I mentioned, the toxin dose and degree of exposure, somebody's elimination pattern. Yes, I just recently met somebody a couple of months ago whose wife was having a bowel movement every month. Every month, my jaw dropped. You know, so we have to eliminate 80% of our heavy metal load comes out in the stool. So if we're not pooping, that's a huge problem. I mean, you've got to talk poop with clients. That's like number one, because most things are coming out that way. So deficiency, and I'll get into that, differences in genes, and then focusing on the gut, of course. So when it comes to assessment, what I would say is symptomatically, when people start getting achy and having lots of pain and they don't know why, it's not like it's related to a workout, but you know, something happened and all of a sudden they have joint aches, I would start to be thinking about toxicity. If they've got brain fog, any kind of, the two top reasons why most people do a detox, and there is some data on this, is number one, fatigue, number two, brain fog. The number one concern of most people when they're surveyed, these are just all different people, is mental acuity. So 65% of people are really concerned about their mental acuity and retaining mental sharpness. So right there, you know, the moment that they're going to have difficulty concentrating, brain fog, these types of things, we want to be looking at toxicity. Other types of food allergies that start to crop up, mood changes, the weakness, or even GI things. But basically anything, I would start to be thinking about it, but then some things a little bit more than others. As far as labs, I'm not going to get into too much here. Essentially, toxicants can be measured, they're primarily measured in blood and in urine. You will find some hair tests. There are pros and cons for each of these. Hair is usually less expensive, usually more easy to do, especially with children, but not always as accurate. If you look at some of the studies, they look at sweat. Stool can also be measured. Adipose tissue would be great, but who wants to do a fat biopsy? So the way that we have to assess toxicity is either you can do a direct test. So Genova has a really good test, and I've experienced it myself. It's a very expensive test, but it tests all the different categories of different toxicants except for the heavy metals. They don't test the heavy metals in this one. So they're looking at phthalates and parabens and volatiles and styrenes and, you name it. I mean, and they're looking at this relative to lipids like triglycerides, which I think is good. They've done a really nice job on that test. So if you're a person who has these unexplained symptoms where you just don't know where something is cropping up, or you've got a client that has just unexplained symptoms and they're the walking wounded, going to practitioner after practitioner and not really finding a solution, one of the best things that you can do is a more comprehensive toxic panel. This will run about $900, by the way. It's not cheap, which is my teaching premise clinically with labs is, unless you know what you're going to do with that result, why test it? You have to know what you're going to do, or if you need to find something to explain certain symptoms, right? So somebody just contacted me today, a previous student of mine, who said, hey, my styrene concentrations came back elevated. What can I do about that? So, again, I think it's good to put it within the context of the whole. There are also indirect things. Like, one of the things as nutrition professionals to focus on is a nutrient panel. We need more of that. We actually need many more nutrients that are even already assessed, in my opinion. I'd like to see some phytonutrients on those panels. I only see a limited number, like carotenoids. We need a lot more, but at least we've got some of the basics that are available to us through a variety of the different labs like SpectraCell or Genova or Doctor's Data. We can also look at indirect assessments. One of the best things, if you have access to this, is a simple questionnaire. For the IFM has a great, we teach to a very simple questionnaire with 20 questions. It's just one page, and it gives a good sense of where there might be exposures in the environment, and then you go further. I don't always think that as a healthcare practitioner, we have to jump to labs. I think that they can be really pricey and may not provide a lot of therapeutic benefit because we don't really know what the action step is. So what I think is really important is first to do a very extensive environmental toxicant exposure history. And so there are very in-depth ones, there are very short ones. And if this is part of your practice and you want this to be more integral to what you're doing, I would say definitely make this part of your intake. You can get a lot of information just from a very simple questionnaire, without having to do a lot of these expensive labs. So on a questionnaire, you're going, and if you want to create your own, that's great. For, one time I was teaching, I had the students create their own questionnaires, and it was so interesting to see what came out of that, because we all kind of have different lenses into this, and there really is, in my opinion, I've never found a perfect questionnaire yet. So there can be outside exposures that we want to ask about. So the obvious, I'm not going to go through all of these, you can see those. Inside exposures. In fact, I was just reading a study the other day showing that people that heat their homes with a wood stove, and I used to heat my home with a wood stove, that they have increased risk of breast cancer. Just the propensity is higher, of course, because of all of the smoke particulates and such. So, but we don't often think about that. We just think, oh, cozy and fireplace, and we've got to put it all into perspective. I think even bigger than smoke is mold in the home, and that's an insidious one that is not easy to rectify. And so you want to be asking about that. I can go on and on mold. Okay, hobby and work activities. I can remember clients who he liked stained glass. That's what he liked to do as his hobby. And of course, he had all kinds of health issues, type 2 diabetes. He was morbidly obese. And, you look at all of that lead that he was exposed to in the stained glass process with the solder, and that was part of his issue of, his environmental exposures. But all of these, really to think expansively about them. And then, of course, personal. People on polypharmacy, multiple meds, we need to be thinking about those interactions and the toxicity as well. You also want to be looking, and especially if you are in nutrition, you want to be looking at diet and lifestyle, right? So having a consolidated form, which not only looks at food as an assessment, but lifestyle, so that you can see the snapshot of the whole. What is the person doing as the whole for their entire day? Because sometimes one thing is triggering something else. So how we sleep and the quality of that can determine how we eat the next day and whether or not we have carbohydrate cravings. So it can give you so much information. And then finally, review of the environment. Aside from questionnaires, kind of going deep, I think also doing, as I mentioned before, the water analysis. I think that is big. And as part of the water analysis, getting a home mold assessment. If you do get this done or recommend this to clients, you can just find a service typically locally, like a chemical testing kind of company that can do that for you. My best guidance there is choose a company that is not selling a product to remediate the mold, because they will automatically probably find mold. And it may not be there. So, we can't just assume, but find a company to come into the home and to test. They will test two things typically. One is drywall that is in the kitchen and in the bathroom, because those are the most moist environments. And so what yeast and mold like is essentially cellulose and water, which means they like books, they like walls, they like clothing, paper, anything like that. And so they will test, they'll put a pin inside your drywall and extract it out. And then they'll also take an air sample quality and just essentially look at it for mycotoxins, and they'll assess it relative to your outdoor air. All right, enough on toxins. What do we do for detox, right? And this is a practice that is, as I was mentioning earlier, as old as time, as old as humankind. And the way that I see detox is it's a balancing of our outer environment with our inner environment, the elements, earth, air, water, fire. How do we blend them all together and balance them? So clinically, I think about these steps, right? First, removing, trying to figure out where is the source of contamination. Do what you can. What is blocking? What is the toxin that's preventing the flow? Protecting against toxicant damage. I'm going to talk about that with nutrients. Support elimination routes. And it's not just the gut and regular pooping, but also urine and sweating and breathing. So many of us are shallow breathers. And just think of, again, all of the air pollutants that we are collecting. And then enhancing certain pathways, so specific to the liver, and then reevaluating. Now, some of these are done simultaneously. And so having the first three, you can imagine, can happen all at once, where you're identifying and removing using assessments, making sure that you're protecting and then supporting the proper routes. And before I have somebody on a formal detox program with supplements and the whole shebang, I am making sure that they are properly eliminating through their gut. You don't want to have somebody who's constipated start taking a lot of detox supplements. That would not be a good thing. So in terms of nutrition, this, that there are phases of metabolic detoxification that happen in the body. And the way that it's contextualized within medical science is within the phases, phase 1, phase 2, phase 3. And throughout each of those phases, we have to look at the nutrients. These are all of them, phase 1 through 3, they're all nutrient requiring. So when you're looking at your client's food log, looking at the relative list of toxins, versus things that are detoxing, to see what that balance is. You know, you can start there as a nutritionist or health coach, very simply circling things in red if they're more toxic, circling things in green if they're health promoting, and simply looking at the balance of those two things. So one of the things that can circumvent a lot of the effects of toxins is really nutrients. So this is a great study. I would say to take note of this one, just go to PubMed and enter it in, because this author actually just came out with another study from 2017 saying essentially the same thing. But basically, the bottom line is that when you have enough nutrients, you're protected from a lot of the toxic exposures. When you do not have enough nutrients in your body, it can perpetuate some of the inflammatory cascades that are created by these exposures to environmental contaminants. So my big thing, I get asked all the time, Deanna, how do you eat? And what I say, the only consistency is the variety of plant foods that I take in and the colors. And if you look at the study that's cited here below, fruit and vegetable intake influences the association between exposure to polycyclic aromatic hydrocarbons and a marker of oxidative stress in pregnant women. I always get the question too about, what do I do if I'm pregnant? Well, you can't do any kind of supplemental approach typically. And so plant foods that are as clean as possible. So making good, healthy choices there, and washing and preparing them well. So I know we hear a lot bantered around about food as medicine, and you know that there's some truth to that, but I think we should be more specific. And my my way to make this more specific is to talk about colorful foods, because really and truly I think that it's a unifying principle for many people that we all can collect on this anchor of colorful foods for detoxification. So back in 2015, I worked with one of the students that was interning with me, and we wrote up a 24-page review article looking at all of the plant foods that are well researched for detoxification and the different bioactives. So if you scan this list, you can get this article, by the way, it's open access on PubMed. If you just go in and you put our names in, you can download it and you can get this very list that I'm showing you here if you ever wanted to make a handout for patients. So lots of foods and beverages. And what really came out of this for me is, my goodness, how many beverages are responsible for detoxification? A perfect way to punctuate the day, get in your pauses, and also detoxify. So I just love that, because most times we can detox without even thinking about it. Most times we're thinking of foods to avoid. This is where the elimination diet comes in. This is the first phase of detox in the IFM, the functional medicine protocol. So it's taking things out. And so there are some studies on this. I use this clinically for many years, the elimination diet. And typically what you see is a really nice reduction in symptoms within the first 7 to 10 days, even though it goes as far as 21 to 28 days. So this was a study in which they looked at, this was a detox program, which had the elimination diet plus a detox protein powder, and they had a really nice reduction of about 50% within 7 days. The other thing I want to mention with foods here is about food prep. So in fact, I just finished working on a blog today on advanced glycation end products, AGEs, and how these things that are produced with cooking. So the more frying, grilling, browning of various types, this all denotes inflammatory precursors in our bodies. Our bodies do not like, we like the taste of those things, but in the body, those things do a lot of damage. So we can make a food toxic just by overcooking it. So using proper cookware, and I like to use a variety of different types, just like, you know, that's my principle for everything, variety, 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 even variety. So what I like here is stainless steel. I like cast iron for certain people. It just kind of depends. There are various companies. I used to like one brand and then figured out that it wasn't the best. There are some good pharmaceutical grade stainless steel pots and pans out there that I think are excellent. So, you know, and that's typically like a one-time purchase in your life. It's kind of like a lab, like your gene test. You just do that once, because those pots and pans are pretty darn expensive, and you don't need to purchase them again unless you damage them, like sometimes I do. So slow, low, moist, no dry, hot heat. Dry, hot heat leads to a lot of the production of these inflammatory cytokines from the food within our bodies. And you know, I just don't think oil is necessary to cook in. I use water. What is a better conductor than for heat than water? I mean, water is excellent. That's even how we heat our house, is through radiant heat, you know, heating up water. I mean, water it's just a good, clean way to cook versus using oil. So I think that that's important. So this is what actually happened to me. I had a really expensive, what I thought was a really good quality pan. I'm not going to name the brand, but it actually scuffed and it started to flake, and it was never supposed to do that. And they did replace it, so I'm very happy, and so I'll use that sometimes. But you've got to, you know, this was supposed to be one of the healthier pans, which is why I rotate. I definitely rotate. I like to get a variety. Avoiding plastic when it comes to cooking. You know, when I see those chickens or turkeys in plastic bags when I go to Whole Foods or grocery stores or around Thanksgiving, it just makes me cringe. Because again, to repeat that mantra, heat, oil, plastic, not a good combo, not a good combo. So you want to avoid that. And so things that you have around heat and that have some connection with oil, you want to avoid using any kind of plastic. I mentioned to you that plastic turns over relatively quickly in the body. Doesn't mean that we shouldn't avoid it, because if we're constantly chronically exposed to plastic, we will build these things up in the body, right? But in this study, they had people go off of plastic just for 3 days, and BPA and phthalate levels reduced by 2/3, or a little bit more than 50% for the phthalates. So that's pretty significant. They do have a fast turnover. Do I like organic food? Yeah, it's the higher choice, absolutely. But is organic food is it perfectly clean? No, of course not. I remember reading a statistic somewhere stating that 30% of organic food is contaminated. And it's just because our environment is so incredibly toxic, and we can't avoid some of these exposures, right? This study, let me just summarize it for you without doing all the reading. Basically, this was in kids. They fed them for 5 days an organic diet, and they moved them to conventional, then to organic. And what they found was that their levels of a certain pesticide had gone down significantly and quickly, just within a short period of time of being on the organic diet. So yeah, it makes a difference. I just posted in the whole detox community on Facebook, and also I just put it into my presentation that I was just working on, another study showing that organic meat isn't free of toxins. And I'm not against meat. I'm not wedded to any dietary dogma, by the way, only eating colorful plant foods and variety. That's kind of my staple. But outside of that, I believe in personalization, absolutely. But I get this all the time from people. Oh, but I eat organic lamb or beef or pork, and yeah, that's the higher choice. But know that it doesn't mean that it's free of toxicants, because the poor animal is exposed to different things in their environment, just like we are. So all that it means to have organic meat is for that animal to be fed organic feed, and that they can graze. Okay, so what if they're grazing on contaminated soil or land? You know, those things are not controlled for. So this was an earlier study. This was done in Europe, where we would think that things are a bit cleaner. 2015, essentially showing that organic meat was not free of persistent organic pollutants, and in some cases were slightly higher. The recent study that I just posted, it was from this year, 2017, I believe it was April, showing exactly the same thing. In this study, they did more samples of meat. I think it was 230, something like that. You can find it if you go to PubMed. It was a Spanish group that did it, and essentially they found the same thing. So lots of different options here for reducing. That's the first step, is really trying to figure out how to reduce. So limiting a lot of the fatty animal-based products, or eating with greens and preparing with spices. That's what we wrote about in this recent blog about metabolic endotoxemia. we can override some of those effects by including a lot of the medicinals of phytonutrients and spices. Avoid high heat cooking and cooking with oils. In fact, I just found a couple of articles showing that, you know, the advanced glycation end products that I was just speaking to, that there could be a connection to allergy. So that's being explored and investigated. So it could even be not the food, but how it's being prepared that's causing the issue. Of course, you know this, no brainer here. Limit sugar, avoid artificial sweeteners, avoid farmed fish because of the PCB contamination, choose wild. And of course, avoiding genetically modified organisms, and if you have clients that are sensitive to gluten. So when it comes to food, the way that I structure this for Whole Detox is I based it on the more of the ancient traditional system of eating, which is pretty amazing that in Ayurveda and in traditional Chinese medicine, they understood when body organs work best. They were master observers. You know, we as now scientists in the medical profession, we look at things in a different way, but they were the master pattern recognition experts, right? So in fact, I was just looking at literature on this recently, looking at the detox enzymes and when they express in the body. It's really fascinating because the liver is very connected into light, cycles of light. And so dawn and dusk are periods of lots of activity enzymatically in the body, dawn and dusk. So, you know, there's something to be said about this. I mean, I'm still exploring all these different, a lot of this has been done in animals, and because animals are nocturnal, the ones that they study, like rats and mice, it's hard to make these, I think, extrapolations to humans because we have a reverse cycle. So, but we're still learning about this, and there are certain drugs that are given at certain times because of how they're metabolized. And where did detox come from in the medical field? It came from pharmacokinetics and metabolism, right? So anyway, smoothies, something cooling and nutrient dense. My mantra for all of these meals is protein plus plants. Repeat, protein plus plants. I just think it's the easiest way, P squared, because protein and plants are required for detox in the body biochemically. I'm not going to dive too deeply into supplementation. I have a whole lecture on this, and I do have as Paula mentioned, a Rainbow Foods and Supplement course I've already been preparing for. There's no limit to the depth of where we could go with that one, but I'll just give you a couple of studies here just to show you the power of taking certain nutrients. Here is our good old friend vitamin C. Vitamin C given at 1 gram a day for 2 months to healthy people. How rare to find those people. 15 of them, as a small study, led to significant decreases in persistent organic pollutants over the course of that 2 months. Just something as simple as vitamin C. And I can already think back to the pathways that I know that's priming from a detox perspective. There are certain ones, especially glutathione S transferase. When people have deficient GST, glutathione S transferase, enzymatic activity in the body, they tend to get really fatigued. Vitamin C is what helps to regenerate and helps to replenish glutathione. And by the way I like to take a lot of these supplements is not how they're tested. Typically, they just give ascorbic acid. I like to see a whole composite of different things that support vitamin C activity, like the bioflavonoids. This is another study showing a similar thing. These are factory workers who were exposed to lead or not exposed to lead. They gave them vitamin E and vitamin C at pretty modest amounts. They gave it for a year. Again, another small study. And what they found was that having the additional antioxidants helped to decrease the oxidative damage that happened with lead. By the way, quick note, since you're nutritionists, I'm not a huge fan of bone broth on a reoccurring, consistent basis because I think of lead. I think of where do we store a lot of these metals. Bone is one of those tissues. I think about perimenopausal women losing 3 to 5% of their bone mass 3 to 5 years within that perimenopausal time frame. You know, that's huge. And a lot of these bone broth manufacturers, when I go up to them at the nutrition conferences and I ask for their spec, they're like, what? You know, you want me to measure lead and mercury and cadmium in this bone broth? That doesn't make sense. I'm like, yes, it does, because you're liberating a lot of these metals through the process of extreme heat. So I get a little bit leery on some of these trends that come out. And again, that's what brings me back to variety. Not that bone broth in and of itself is never good. I happened to run into somebody at a conference who was giving their baby, their 6-month-old, bone broth, on a pretty consistent basis. And I said, do you have any concerns about, the different contaminants that could be in there? But these foods seem to take a health halo for some reason, and they seem not to be touched. But I'm a stickler on things like that, like bone broth, which is perceived as a health food. So people are just going to do more of it. There's even an abstract. If you go to PubMed and you search for bone broth, there's one article that comes up showing higher levels of lead. But of course, and then people say, oh, but I use organic meat and organic bones. Does it matter? No, because organic has nothing to do with heavy metal content of animals. It doesn't. I'm surprised you don't know this. You're in the fields. So it doesn't matter if it's organic or not. It's still, there could be contamination of these metals. And again, heavy metals are I consider them up high on the list of having greater toxicity. Okay, moving along, singing a song. I know what Paul is thinking here. So beta-carotene supplementation, also helpful in these lead-exposed workers. Just another study. I would never use beta-carotene like this in isolation. I would use it as mixed carotenoids. And again, I go into that more in my supplement course. I think that there are good ways to take supplements. I think that there are bad ways to take supplements. But anyway, they did see a reduction in oxidative stress, a mild reduction. I was part of a clinical trial with women with fibromyalgia, in which we had them on a 4-week program, which had an elimination diet plus a phytonutrient protein powder. And we saw some pretty fantastic, this is published, you can find this on PubMed, pretty fantastic results for these women. And what really hit me was when we looked at the data and we saw that for the women that had greater numbers of amalgams, they actually had better reduction of symptoms with this program. It was almost like they were just more toxic, and so they were able to improve even more. So get elimination happening, right? You know that. Adequate fiber, we in general just get way too little in the way of fiber. Fiber means you have to include water. Don't forget to rotate fibers. I'm covering that as well in my supplement course, because I've seen people develop an allergy and intolerance to fibers when they're using them supplementally. So complexity is key there. I'm kind of mixed about fermented foods. I could go into that if you want, but I think that there are some pros. I think that there are some cons. Whole plant-based foods, probiotics. Probiotics actually help us to metabolize heavy metals. There was a study from women in Tanzania showing that when they had yogurt that had certain strains of bacteria versus women that just had milk, that these probiotic strains seem to help with metabolizing certain of the heavy metals. In fact, here is that study. It was on looking at lead specifically. So nutrition, chelators, what will bind a lot of these metals? Fibers, modified citrus pectin is out there and pretty well studied. Chlorella, cilantro, coriander, a lot of these greens that are really fibrous and fleshy. In fact, there's this great article, this nutritionist had written up his case studies talking about how cilantro, having cilantro soup, it was not raw cilantro, it was cilantro soup. It had to be cooked, it had to be cracked open. And that's why, again, knowing about how to prepare these foods is key. So this was a 54-year-old dentist, doesn't eat a lot of fish. She was recommended to have this coriander soup. And eventually, after several months, she had a nice reduction in mercury, and her levels were tested at baseline at 6 months and then at 12 months. Same thing here with a 38-year-old chef. He ate lots of seafood. He was infertile, and essentially he had high levels of mercury. He was told to stop eating his seafood and to have that coriander. Coriander is synonymous here with cilantro. So he had the soup daily, had the test redone, and essentially was able to help his wife conceive. So a lot of these greens, chlorella is great for detoxing heterocyclic amines. Chlorella here also decreasing dioxin in breast milk, which is great because pregnant women always want to know what they can take that's safe. A lot of those green foods are great. And something as basic as chlorophyll. Chlorophyllin is the stabilized form of chlorophyll, but chlorophyllin is helpful for reducing DNA damage. And that's what gets us into trouble because of all these toxins, right? A lot of the damage that they can cause. Spirulina is also great. There's a wonderful review on this. And so there are many different brands of that. Zinc is also wonderful. All minerals. I think that minerals are a big deal for keeping heavy metals in check. So there are a number of papers that were published in the 80s and 90s that showed that when we had enough of our essential mineral levels, that it buffered us and protected us from having too much in the way of heavy metal uptake and regulation and receptor activity. So heavy metals, not always easy. Take an antioxidant supplement is what the studies would show us. Ensure adequate methylation. For example, that's how arsenic is removed from the body. Make sure that you have proper mineral levels, and there are tests in which you can look at the lab levels of these different minerals in clients. And sweating, because most everything comes out in sweat except for perfluorinated compounds. You know, in this particular client of mine, I've been following her for years. She had rheumatoid arthritis, and essentially she had already done the elimination diet, but she was still having some symptoms. And so I gave her a detox powder, and within 7 days, she had a 68% reduction in her symptoms. This is called the metabolic detoxification questionnaire. She was sleeping better, and then she had this rash in the back of her neck that she had it for the longest time, and we couldn't explain why she had it, but it went away after the first week of being on the product. She hadn't had any weight loss, but she did have increased energy. So in the absence of making dietary change, I do think, or even if somebody has excelled at that, I do think it makes sense to bring in, you know, something that's targeted to help people along. And then I will just gloss through lifestyle. You all know this. Nutrition is your core, but you know, I don't want us to forget about lifestyle. We need to sleep well. When we're not sleeping well, we're going to have food cravings. We don't detox. There was this very fascinating study showing that sleep disturbances have a connection to different toxins, very specific ones. Whether you're unrested, you wake up at night, you have leg jerks, you have leg cramps, all of these different things. So sleep disturbance, you should be thinking toxicity. We need to move, we need to circulate these things, right? So this is where sweat comes in when I'm thinking of movement, of a variety of different things. In fact, Dr. Stephen Jennis at the University of Alberta has done some really elegant research on sweat. He did this study called the BUS study, blood, urine, sweat, and he compared the different compartments, and he found that these metals and minerals were released more extensively in sweat compared with urine. So you see mercury on this list, right? You see aluminum on this list. You see lead on this list. You see cadmium. You see a lot of the big offenders on this list just from sweat. So I interviewed, you know, somebody on saunas as part of the Detox Summit, and there's a lot out there on this. I do believe it's important to invest in a sauna. I personally have a sauna. I just want people to sweat. It's one of the best investments, I think. So there are different types. I don't get too attached to that. Is infrared better than steam? Well, it seems like, you know, they get different things out depending on the modality. Emotions, I alluded to this already. Regulating one's emotions. Now, that doesn't mean just managing them per se, but just really, you know, flowing and working with them in healthy ways leads to a 14-year greater chance of survival relative to people who can't self-regulate their emotions. I mean, I have a ton of research on emotions. Paula can invite me back for a whole talk on that, because I just feel like it's an undervalued, under-recognized, and almost a feared topic in clinical work that we do. But it's huge. You know, our emotions determine our behaviors. So stress is pervasive. There are many different types of stress. Exploring those during a detox would be good. And if you don't directly, it'll come up. I can guarantee it. Stress and pessimism. I mentioned this before about being connected to inflammation. There's even some newer research. Like I said, I was just looking today at this for a different presentation, and there's a lot of work here. And essentially, being pessimistic and cranky ages us. And if that doesn't inspire somebody to change, I don't know what will. But it's true that we have an effect on our telomeres and our DNA when we are pessimistic. So here's where we have the final home stretch. You're talking very finally about whole detox. This is what I've decided to put together based on my clinical experience working with Jeff Bland and others at the Functional Medicine Research Center, and just even having a private practice seeing people. You know, a detox can do a lot of things for people, you know, so it can do emotional things, physical things, mental things, but there has to be an investment. It's just not, you know, like take this supplement and you're done. You gotta you have to have some consistency and flow. So when I do the whole detox, Paula has done the whole detox with us too. We do focus before we start on the home, mind, relationships, and then we dive into food and different other lifestyle modalities. So, you know, small things can make an impact too. It doesn't have to be perfect. And I do think that even if you focus on one thing for a detox with your clients, like let's just say you decided just to focus on colors of food, that would be huge because you're crowding out the foods that people shouldn't be eating because they're not healthful, and they're not helpful in the body. So looking at their symptoms, if somebody's really chronically ill, I like for them to go really slow and low with the program too. So with whole detox, just really looking at, I anchor everything. Everything I do is color coded, right? So I have these 7 colors and they all funnel into a multi-level compartment of different factors, which I'd be glad to give this to Paula if people wanted this. This is how I organize this. This is also in the whole detox book. Then you can take the quiz to figure out where you need the most help in terms of the detox, so you can kind of personalize it. And so this is, the takeaway is that this is how I do whole detox. It's 7 colors, 7 different toxins, 7 different detox modalities. In fact, I just saw another study on guided imagery. People ask, well, you know, what about these visualizations? Well, if we visualize where we're going and what we're doing, I mean, this is even used in oncology. So it's powerful stuff. You know, even if somebody going through whole detox just said, I'm just going to do affirmations, I'd be thrilled. It's not a lot of effort, but it gives a lot of returns. So either people can do all of these, they can do some of these, or one of them. You pick. Because really, you know, this is a constant process. We're always in the process of detoxing. I did do a large program with the Institute for Functional Medicine that looks very much like Whole Detox now, as it is published. We collected data, and essentially what we saw, and this is pretty amazing to me, we're still in the process of getting it published and getting it all together, but essentially what we found was that out of all the things that we looked at, emotional health improved the most, followed by energy, followed by weight. You know, everything improved, but it's just pretty fantastic to think that, wow, you know, primarily we were changing their food, yet their emotions scored really high in terms of improvement. So I was definitely happy to see that. So these are just all of the elements of the medical symptoms questionnaire and how everything came down. All right, it is 3 minutes over the time I'm supposed to finish. I'm going to let you do the takeaways. I don't want to say anything more. I'm done. I'm sure there are a ton of questions, and we have some time reserved.
The queen of detox just ran out of words. I've never heard this before, Deanna.
Well, usually if I'm in an audience, I love for them to tell me their takeaways because, you know, I want to know what is clinically relevant for you in the audience, right? So yeah, there are so many takeaways, right? But you know, yeah, it'd be nice to know what's relevant for everybody listening.
Absolutely. Okay, we're up to question period. Everybody, let me know if you haven't already loaded your questions. Now is the time to get your hands raised and questions written up here. One of the things I think we can return to, Deanna, just to frame this a little bit, you started talking about whole detox, and I think maybe you need to explain that whole detox is your approach to detoxification. As the queen of detox, this is what you've put together. It's your program. It's your 21-day approach. And so we're going to talk about that coming up in September. But just to frame this here a little bit, I think you could give it a couple minutes.
Yeah, and the reason why I came up with this is because of all the years that I was just doing nutrition and just doing nutritional protocols for detox, what I was finding was that people were having some pretty cathartic life changes. Like I remember one woman who, she wanted to quit her job and like go into an entirely different profession. There were multiple people that wanted to end relationships. They wanted to either get a divorce or break up or start a new relationship. There were other people that they wanted to just move, like physically just change their location. For some of them, their relationships with family had improved. So I started to see that, oh my gosh, there's something really big happening whenever I do a nutritional detox. Like these people are resetting their lives. And then I thought, well, why wouldn't I accommodate for all of these changes and prepare them and give them tools to make it a little bit more seamless so they don't come in crying and, you know, their life is just like, oh my gosh, there's so many changes. What do I do? So that led me to whole detox, quite honestly, because I just think like you do, Paula. I think in systems, I think in wholes, and I don't think in parts. I think in pathways of, you know, food is so powerful that it can create a lot of these lifestyle changes. I also wanted to equip people with what they needed in order to do these things in a way that felt more comfortable for them rather than just kind of flying off the handle. So having this more, I would say, a nutrition plus a lifestyle program, I think gives people a lot of options and choices. And we function better when we have the locus of control and we can say, hey, Deanna, I don't want to do the food. I'd rather focus on my emotions this time because I know I've got a lot of anger. I need to do something with that. Or I've got, you know, a lot of toxic thoughts. I want to do something with those. I know that they're just plaguing me. I already eat really well. And I started to find that a lot of people, just like back to that one patient I had who was, who had rheumatoid arthritis, she was brilliant. I mean, the woman, she did everything right. So then we had to start focusing on other things. And I realized, you know what, detox is bigger than food. Detox is, there's something spiritual about this. There's something medical. There's something really ancient about this process of cleansing. And I need to honor that. Right. So I did it in the way that I knew, and that became whole detox.
Well, you do honor it, and I think that's what sets you apart from everything else. All these little approaches, and you know, just a supplement, and just a powder, or just, you know, some juice fasting, and you bring the whole picture, whole life of whole detox, every aspect of it. And so it comes down to the individual of what we want to focus on. You can address all of it as you go through the 21 days, and really dial in on a certain system or certain aspect of it. So I think it's just brilliant what you've put together, but it's authentic to you, but it brings in, like you said, it's all of it. It's the spirituality, it's the historical and cultural approach to this that's just so helpful and healthful.
I almost don't even want to call it detox.
Yes.
You know, Paula, in fact, I tried to arm wrestle my publisher on this, and you know, but who wants to buy a book called Lifestyle Change, or, you know, something, you know, like we were like going back and forth, what do we call this thing? And you know, detox is such a charged word. And so, you know, people have a connotation, and once they're roped in and they start reading, and I can't tell you how many people have written me saying, oh my gosh, I had no idea your book was about that. Right. You know, I thought you were just going to give me like some kind of food cleanse or juice cleanse or something like that. I didn't know what you were tackling here. So yeah.
Yeah, it's different. Check it out. It's worth checking out. Changed me, brought me right back to present. All right, let's get to some questions here before we get into the other things that you're doing. You know, one of the things you started with was sequencing a detox to make it safe, and it's one of the things that we emphasize so much at Hawthorn. There's a detox course in the clinical programs that our students take, and it addresses 3 phases of detox and setting up a detox protocol that takes into account those 3 phases, and really helps the client prepare for doing a detox mentally and emotionally as well as physically, and then what the specific detox is, and then how to play it forward, how to translate that into the rest of your life for lasting changes. So I appreciate the sequencing a lot, and you don't see it. You just don't see it in a lot of places. And so, yeah.
Yeah, and let me just make that really clear for everybody again, Paula, in case they're thinking, what is she talking about sequencing? There's a high level sequencing, which is based on the organs. So first going after the gut and getting the gut flowing and moving and eliminating, and then working in towards some of the liver pathways. And then if we drill down into the liver, looking at, there's phase 1 hydroxylation, and then there's phase 2, then there's phase 3 looking at bile. So, kind of staging it. But first and foremost, before I get anybody going on anything, I really want their bowels moving. And when we talk moving, 1 to 2 per day,
Mm-hmm.
I used to work with a surgeon who was hilarious, and he would show the patients with his arm. He's like, I want you to have a bowel movement that's as big as your forearm. Like sometimes you actually have to talk about the quality of the stool that you're looking for before you get going with a detox, because if you've got pebbles and you really want logs, you got to.
And if people don't know, I mean, it's a big piece. If you and I encourage our students to do this, if you ask, how is your digestion? People will say fine. But we need specific questions and specific information, because their idea of fine and our idea of fine can be worlds apart. Hence, your client that had a bowel movement once a month or once a week, and I've had that, and you have to not let your jaw drop right in front of people, but it does happen, and it allows you to say, well, that actually isn't great. That actually isn't normal. And here's all these symptoms that are in play maybe as a consequence of it. So
and people don't want to talk about it. I mean, when I was in Europe, people are completely fine talking about elimination patterns, but you come to the States and now people are a little bit more open because the gut has become a big thing.
Yeah.
So that's a good thing that we are now starting to talk about it. But for all the nutritionists, of course, you probably know of the Bristol chart of the stool patterns. Mm-hmm. And then there's like a fun book, a little book for play. What it's called? Not Everybody Poops, but then there's another one that's a really good book that I like to bring in. I just like to make it funny because, people get tight about this, and maybe that's part of the constipation too, is the uptightness. You have to kind of let that flow.
Well, you bring that down to psychological toxins, and yes, I think it's huge. It's like psychological, think limiting beliefs, right? And hence people are reacting versus responding. But yes, it's. Let's see. Get to some question, very specific here. All right. The powders that you had, you mentioned a number of different powders, specifically a cleansing one and also a protein one. Do you mind telling us what those powders are, specific products?
Sure. And let me just say, first and foremost, I always prefer food. So if I can do something with food, I'm going to start there. But when I have somebody where either they're not willing to go in that direction, or they've done everything with food and they're impeccable, like that one patient, then I will start to move to supplements. And so the one that I bring in that I like very much, that I was even involved with the formulation of, is a product called Ultra Clear Renew. Ultra Clear Renew, and that's from Metagenics. A lot of the, probably I could use something comparable from another company within that space, because a lot of them do have a number of agents. But I do know specifically that what the Renew has that a lot of the other detox powders don't have is something to upregulate a protein to get the metals out of the body in a more efficient way. So there's that. And that's a pretty pricey powder. So, that's not going to be for everybody. It's for the people who are really, they say, what is it for a canister? I don't know, like $80. And it's, if you do it twice a day, it's going to last you for about 10 days or 10 to 12 days. So there are other things to use too. I mean, I know I talked about protein powders. You can buy a number of different ones. Just make sure that they don't have adulterants in them. So no sweeteners. Now is a retail brand, and they have an organic pea protein. I would say just really rotate those proteins too, because they all have their pros and cons. Like rice protein tends to be, or can be, high in arsenic. So you want to go with a company that you trust that measures the contaminants in their products. You don't want to be paying for an expensive supplement where you're actually paying for contaminants. So So I'm
and
pretty
third-party testing as well. It's important.
Exactly. And you should be able to call the company and say, can I have a copy of your specification and your testing? And you know, they have a process where they have certain lots. Like this is required by the FDA for nutraceuticals. So, you know, if they're not adherent to these practices, you'll know because they can't provide you a copy of them. So ask the questions and continue. Don't just because they are fine with it 1 year, you know, ask them again in 2 years just to be sure that things are still on track. You know, I was buying for some time a brand. This was a personal care product, and then they were sold to another company, a bigger conglomerate company, and they had swapped out their ingredients. And if I had stopped reading, and I'm so picky, you know, I read everything, and so I noticed, I'm like, oh, why did they swap that? I'm not buying this anymore. So that can help in any
the name is the same, but the product has changed.
Exactly.
And the ingredients.
Exactly.
Yeah, it's this constant awareness. And I notice this in restaurants too. They'll come out and they'll just have a heck of a good menu. Everything's so sourced really well, and you just get these big portions, and then they get real popular. And then it starts going downhill from there. And it's you know, people get bought out to these supplement companies or whatever, and quality just tends to go down. It's like we've attracted attention now, and we just can't keep up with what we started with. And so we have to do our diligence as professionals and consumers as well. I want to come back to whole detox just for a minute and this overall theme of detoxification here, and say that our personal awareness is so important. And I think that's what whole detox accomplishes more than anything. When you invest yourself in it, you can't help but increase your awareness about yourself, the way that you're living, and your lifestyle, your own behaviors, and the effect that it's having. And it just gets bigger and bigger. And you know, one of the things when we did our plastic challenge last time, that looked at so many different things, and you talk about different professions and the hair care salons and things. I get into dentistry and exposure and the work that they're doing, and orthodontics specifically with braces. The braces have moved from metal, which have their own issues with the metal that they're using, but with the Invisalign, that is the exact plastic. That's the worst plastic that we're trying to encourage people to avoid. It's thinner than water bottle plastic. And this is something that's in people's mouth 24/7, really for the rest of their life, because for the duration of the braces, and then the retainer that they put in at night. So,
and the liberation of the plastics every time they chew, that's been shown for amalgams. Dr. Mary Ellen Chalmers is a dentist that I teach with at IFM, and she talks about that, you know, that these things aren't static. They are dynamic and releasing, whether it's gas or particulates, and especially with the plastic.
Mary Ellen Chalmers is going to do a presentation for Hawthorn in the beginning of 2018.
Right, she's your dentist. I forgot about that.
she's my dentist.
Awesome.
But she's just fabulous, you know, as being part of IFM and what she brings to the field of dentistry and the care and the attention. So it'll be a great presentation. I'm really looking forward to her. I'm glad you brought her up. But, you know, just to finish up on this body care product, because there's a number of comments about this. We have UPS delivery come here at Hawthorn, and we will run out to meet the driver, because I swear you talk about guys only have 8 chemicals in the morning. These guys, and every single driver, I think they load up on their cologne every time they come here. And I don't know if it's because they're delivering to women or they just do it, but I mean, it's so strong we can't let them in the door, you know. We're like, oh, we're so happy to see you. We'll come out and get our box out here.
Yes. You know, volatiles is one of the underestimated forms of toxins. You know, I think about it in taxis with those air fresheners. I think about fabric softeners. And there is a lab that measures volatiles. As part of that Genova test, they do look at things like benzene, you know, people that work in a lab. I think of how many years I used to work in the lab on the bench with all of those terrible contaminants. You can actually assess things like that. So yeah, the colognes, the perfumes, that's why in your clinics, you know, have signs that say no fragrance is allowed. You know, we have to get a little bit more strict about those things, I think. And yeah, they're just so incredibly toxic. I just have to say that there was a woman that came to one of my in-person detox seminars, and came up to me right before we started, and she says, Dr. Minich, I don't typically go to these seminars because if somebody walks past me and has a fragrance on, I immediately get a headache. So I'm sitting in the back of the room, and please don't be offended that I am, but the reason I am is because I want to be able to leave if I have to, and not to have so many people coming by me. I mean, to think that, there are people like this, the yellow canaries, that are super sensitive for various reasons. This poor woman.
Yes. Yes, and so how brave of her to acknowledge that and to state it and put it right out there, that she's that aware and that careful and but also to share the information that that's having.
Oh, for sure. Yeah,
Sorry, she's living with that. There's a number of questions, people wanting to know if this is recorded, if there's going to be slides available. And so let's take a moment to address that now. Yes, this is being recorded. Yes, Hawthorn almost always has, we always have our recordings available within a few days up on our website. This one will be too. But there's been a situation that's come up to our attention with Dr. Minich, and the slides won't be available. They'll be available for you to view, but not to download. And I want you to talk just a little bit about what's happened, Deanna, and the reason for that.
Yeah, I think just in general, when slides are made available, often, just like other content, they can be repurposed and used without permission. And so I've had some recent issues with that. And so I've just asked Paula if it would be okay if we just give out to everybody the recording and go with that. And so I'm hoping that you've taken the notes that you need, and if you have follow-up questions, that Paula and I would be here for you. But yeah, I prefer not to give out the slides and make it widely available.
Let me just say this: copyright is a very important issue in the professional field, and stealing out someone else's work and using it as your own is just unacceptable. Plagiarism is evil, in my opinion, and it's taken as an egregious offense here at Hawthorn, and we learn about citing our sources as we speak and in writing, and it's just good form that if you're using somebody else's work, to give them the credit for it. Use it. Dr. Minich isn't saying, I don't want my information out there. She wants everybody to have this information, just wants to know where it comes from. And so be respectful, be careful. And if you see somebody else doing that, say, hey, isn't that somebody else's? Call them out on it.
Thank you.
You bet. All right, a couple more questions, and then I want to follow up on other things that you're doing. Did you say that 80% of heavy metals are eliminated in the stool?
Yeah, I remember reading that statistic, that number from a paper that's specific to mercury, is what I recall. So yes, most mercury is coming out in the stool, which is ironic because most of us are measuring it in the urine if we measure heavy metals.
Yes, that's right. And then do you have a name of a lab that you prefer for mercury testing?
Most of the labs out there are doing it now, and they're all around more or less the same price. It'll run you about between $150 to $200 to do a toxic metal test, a urinary toxic metal test. And if you work with a practitioner, which I think is actually really inexpensive because you get a lot of information, and you can also bring in a chelator. If your practitioner decides to do a provoked test. Provoked means that you're given an oral chelator, something like DMPS or EDTA, and then essentially that helps to extract, mobilize some of those heavy metals from your tissues because they do bind so tightly, and then you can measure them in the urine. So yeah, and it's also nice because in those toxic metal tests, you can also get a mineral assessment too. So I kind of like that. I kind of like to see some of those tests where you can see both, like how am I doing in my minerals and in my metals? Because again, they're both divalent cations, and so they kind of compete. So it's good to know how you're doing on both sides.
Agreed. So we've covered a little bit about whole detox that's coming up, but why don't you give the dates? You're starting the end of September and for 21 days.
You got it. So we start September 22nd, which is, I usually like to do it twice a year around spring and at fall. And that is traditionally when detoxes are done, when we have a lot of change in the environment, which means changes in our bodies since we are a microcosm of the macrocosm. So we are going to do this one September 22nd to August. I wish we were going to have a longer August, but October 20th. I woke up this morning, it was 50 degrees, and I'm thinking, oh my gosh, are we moving into fall already? But yeah, whole detox is on the horizon. It's in about a month, and the focus, I like to create themes for all of the whole detox programs. And so they're all online. So all you need is access to be able to get onto a webinar once a week. And then if you decide to participate in an online closed Facebook group, we have a community. And that's always really fun to be part of that dynamic. And you can do that as much or as little as you'd like. And then we follow the program that's in the book. And so I like to lead it with a theme. And this time around, and I usually get intuitive impressions about, okay, what is the theme for this one? What do people need? And this one is going to be called The Healing Power of Color. We are going to take a creative twist into all of the whole detoxes are about color, but this one's going to go much deeper. And I've already been exploring this personally, and we'll be bringing that into the program in very, as you can imagine, Paula, very creative, unusual ways to unlock and get people flowing, which is what we want with a detox.
I wouldn't expect anything else.
It's the best way. So yeah, that's what we're going to do.
No, and there's a number of people on the webinar tonight that have been participants in together with us during your detoxes. So hands are waving. Yes, yes, yes.
Oh, neat. Okay, great.
Big thumbs up on whole detox. And you've also created food and supplement course that you reference sometimes throughout the presentation, as well as your newest book that will be released next year, I think, Rainbow Diet.
Yeah, I'll mention that briefly. So my next book is called The Rainbow Diet, that comes out in January 1st, 2018. So you can only imagine what that's about. It's about, phytonutrients. It's a guide to eating and foods and supplements in this color-coded fashion that I work within. And then I was feeling, and this came to me earlier this year, that because I've done so much education in the supplement arena, I've actually worked for a supplement company for 10 years, and that's all I did was education. I educated doctors and health professionals on how to use supplements. What do you do? What do you don't do if you've got this patient with X? So I felt that this is something that's missing from people's professional lives big time. How do you weave together foods and supplements? How do you know what to look for? I even taught at Bastyr University a course called Nutritional Supplements and Herbs, in which I went through all of this. What are quality things you look for? How do you, and really bringing in the latest science. This is as much of a delight for me as it is maybe for the people that have registered. We've already had quite a groundswell and a lot of interest in this, which makes me think that it is really needed out there, because it's so hard to navigate. So that is a 16-week online course and starts at the end of January and goes until May 20th. And it's going to be pretty intense. This is not for your average consumer, layperson with no nutritional knowledge. It's ramped up. It's more for nutrition professionals and people that have had some background on nutrition.
Terrific. And lastly, your book?
Yeah, that is the Rainbow Diet one that comes out in January. So we'll use that as part of the course, but you should see next to my desk, I've got 2 stacks that are probably about 3 feet high each. I'm now in the process of developing that Rainbow Foods and Supplement course and really getting into it. In fact, I hope that, I think after I teach this time around, I just think it needs to be fed into so many different universities. Yes. And because it will be in a very academic way. This is not a marketing class. This is really looking at the science of these things and the clinical application. So if people are interested in it, they would just go to my site, deannaminich.com, and look under programs, and then you'll see the page there for Rainbow Foods and Supplements.
Right. Great. No, I'm really looking forward to it. We hope to be able to bring it to Hawthorn. We'll let you know about that. So thank you, Dr. Minich, so much. I need to conclude this for this evening because, you know, we could just keep going and going and going. There's much to continue with this.
On the East Coast.
But yes, people need to eat, put their kids to bed and sleep and those things. So let's be respectful of everybody and go on.
Thanks everybody for being here.
You bet. You know, there's a survey that we have after this concludes. I know it's late, but it really helps us to have your feedback and your comments. And especially since we went long tonight, I'd like to know how that was for you. And let you know about our next webinar on Tuesday, September 5th. We have holistic lawyer Lisa Fraley presenting on all ways to do it legal. And she has a lot of assessments and forms and things to give away. So show up for that. It'll be a good one. We'll start promptly at 4 o'clock. And just a reminder about alumni too, with graduate Melissa Peters is next, the September 1st, I think. All right, that's it, everybody. Thank you again, Dr. Minich. This has been terrific. I appreciate you coming back. And I think we had about 8 or 9 other presentations we thought you could show up more for just in presenting this one. So we'll talk. We will. Thanks, everybody. Take care of each other. Practice loving kindness and compassion. It matters.